Welcome to Thriller Bitcoin. Welcome to Thriller Bitcoin.
1, 2, 3, 4.
Welcome to Plub Lab, man. I already started the pod. I just like starting it. I mean, who cares?
Do it. No, it's a growing group. I'm excited to be here at Plub Lab. You guys have been crushing it for a while, and I think, especially with your world travels recently out in the UK.
Doxed.
Sorry.
No, you're fine. Dude, that was that was incredible.
Yeah, tell me about it.
Dude, I think it's just like seeing how many people who like that whole conference was filled with people that have never heard about Bitcoin, their first conference ever. UK, surprisingly, is just not, I mean, there's Bitcoiners there, but it's just not as many as you would think. Mm-hmm. But I think what Peter's doing, especially in Bedford, he's taking the lead, dude. Like literally country lead.
Yeah, I love it. I'm a big sports guy, big sports ball guy growing up. So to see what he's doing with the Bedford Soccer Club out there, winning the league, getting a lot of momentum. I'd love to see that continue in more sports too. I know we had there's a basketball competition every year. Yeah. The Bitcoin Classic.
Oh, yeah.
Haven't partaken in that yet, but no, it's great to kind of get people to rally around a team and really having that cheat code of Bitcoin. I think we're seeing it's that early in Bitcoin's adoption as money that the businesses and individuals that are tapping into it now are seeing that growth, even more viral growth.
Yeah. So let's talk about that. Cause that's why I wanted you on the pod. Cause I want to talk about what you've been up to, but for people at home who don't know who you are, Jon is a big part of the Austin Bitcoin community. When people come into town, usually the first guy they meet, and you've just been, as I've seen you evolve over the course of these years, like I've just seen you become more and more involved with everything around town. So I just wanted you to have an opportunity to kind of talk about what you've been working on. I know you've actually led this like clean health initiative single-handedly. I don't, from my perspective in town, I know the Meat Mafia guys are doing their part, but a lot of that started back when you came to Austin. So can you just talk about who you are and like where you started and all that stuff?
Yeah, definitely. I appreciate you having me on, Car, and Austin, of really anywhere in the US, is an amazing place to live for a variety of reasons. You have a huge health and wellness community naturally, a lot of nature. We've got the Colorado River flowing through. People are very active, a lot of young, motivated entrepreneurs. And then of course you've had the Bitcoiner community really also having Texas be the center of hash. You have different folks across the Bitcoin industry that are building really interesting companies. So my background is working in the healthcare industry. I studied Keynesian economics in undergrad, so I was a little bit brainwashed, but now have come around and done my own research and really understanding money and making my own decisions, and kind of continued moving throughout my career into more and more entrepreneurial roles. So I started out strategy consulting for hospitals and health systems, which was a great way to learn about healthcare and see a lot of the country, everywhere from Yakima, Washington to Bangor, Maine, and some really interesting challenges that health systems are facing and how they can better cater their care to their populations. But it was still a mystery of the financials. We were working with the CEOs and CFOs and C-suite of these big health systems that continue to grow bigger and bigger under a fiat regime, and like all the industries benefiting from centralization. So I actually went over then and worked in a payer space in a Medicaid plan where they were losing hundreds of millions of dollars a year, but they almost didn't care because they were making so much on the commercial side. But then kept going more and more entrepreneurial, worked at a medical supply company, bringing a new product to market in the operating room, got a double master's in health economics and policy, also a bit in the UK. So spent some time in London and also outside the US bubble, understanding all the incentives, really at a fundamental level around how health and health systems are organized. And that's really when I started going down the Bitcoin rabbit hole. I mean, 2020, COVID hits, I finished this program. We were able to be nomadic. My wife and I started traveling. We got married, started traveling around the US, around the world. And as you meet people and all these places I was going, whether it was Zimbabwe or South Africa, Bitcoin Akasi, I'm proud to be their first visitor and seeing how much, they've grown since then, going to El Salvador. And it just opened my eyes to all the opportunities that, having a global monetary system can bring. So, really what brought me to Austin was the crowdhealth opportunity, coming here and being able to combine my passions for Bitcoin and healthcare, and really being focused on the consumer side of things, having this alternative to health insurance where for a while we were saving in Bitcoin. Now members actually last year helped kind of survey the landscape, and crowdhealth is working with Breez now to basically turn the crowdhealth app into a Lightning wallet, which is super cool.
That's sick.
But now that we have, we're going to have people that are funding each other using Bitcoin for the purpose of paying medical providers, where are those docs that are based and get it and are accepting Bitcoin?
Yeah, well, where are they?
They're fewer and far between. So that's really my mission now, is to enable healthcare providers to move on to a Bitcoin standard. I started Satoshi Health Advisors.
Whoa,
SHA.
Sick, dude. Hell yeah.
Which has been a lot of fun.
Wait, SHA for the acronym.
Exactly.
Oh, wow.
Exactly. That just worked out.
Did you get the domain?
I have SatoshiHealth.com.
Nice.
So you can check that out. And, a lot of these ideas have been stewing for a while. And I think even with crowdhealth as well, interacted with a lot of doctors and throughout my career, being on the healthcare side, being able to speak their language and see all the challenges that they have staying independent. It's very low margins. Transaction fees can be 6 to 10% with these high cost electronic medical record systems. So you see more providers, especially with COVID now, opting out of the whole insurance madness and saying, I want to create this value for value connection with my patient, with my consumer, and attract these more sovereign minded, health conscious individuals that we see in Bitcoin. So that's really, my goal now. And I've worked with direct primary care practices where it's a monthly fee subscription, perfect for Bitcoin, dentists, mental health therapists, even local e-bike shop, Mod Bikes. I think you'd love them. They're even more wellness adjacent, but they're now accepting Bitcoin, and just seeing where a lot of people are out there in this traditional industry. Of course, you're still working, but you have a lot of burnout. And I see Bitcoin as this tool for providers to stay independent, not get bought out by private equity or big health systems, be able to practice the way they want to practice and empower their people. And of course, Bitcoin is a tool for lowering those transaction fees, strengthening the balance sheet, and ultimately growing their business and practice. So Austin's really a perfect place to be. And, there's a lot of active communities like the Sapien Center that I got involved with.
Yeah, dude, I saw that. So just real quick, because I want to go back to Satoshi Health before we jump into everything else, because probably going to be a long pod. What time does BitDev start today? Is it 6? So we got time. Yeah, we got time. What was I going to say? So I think the thing that I've seen that you do really well, and I'm starting to realize this, Jon, and want to hear your thoughts on this, but I'm starting to see like you need these people who are bridges to these other ecosystems in the same city, but who are also these bridges. I would call yourself a bridge, but you're also in the Bitcoin community, but you're that bridge to this whole other ecosystem. I don't know if you met Alan Bickerstaff from DLA Piper. He was kind of like
Yep.
that. He's like another bridge into this whole another ecosystem.
Yep.
And I'm just starting to see that happen more and more and more in other cities, but particularly in Austin. Can you talk, why do you think that is? Like, what is it about people like yourself, people like Alan, that are like these bridges to a whole nother ecosystem that Bitcoiners just aren't attracting for whatever reason?
Yeah, I think Austin has people with a lot of diverse interests, backgrounds, coming from all over the world and all over the country, especially from, whether it's from California, New York, myself being, from the Chicago area, and just seeing the writing on the wall. And some places have just very conservative or traditional business models, versus Austin, almost every other person you meet is an entrepreneur. They have an idea, they're following their passion. And so naturally, you have these conversations in the sauna or hopping in the cold plunge or working out or going to, different events, running clubs. I ran the Austin Marathon here last year, and just meeting people throughout, these conversations come up naturally. And as you build relationships with people, particularly the Sapien Center, which is all about ancestral health, getting back to our roots, eating a lot of meat. There's of course a huge tie-in with Bitcoin. Of course, had this movement of paying ranchers in Bitcoin for beef, having this value for value relationship. And so I see these connections and thinking, then a couple months ago, okay, we got the halving coming up. Let's get out of the city and go to Sapien Center to have this halving party, halving celebration, where we'll have a bunch of beef. Matthew Lisak, who's wrote Fiat Food, which is
I saw that, dude.
book.
That's on my Audible list. I need to check that out.
That'll blow your mind. And some of the stuff I knew already, but he just goes so deep down the rabbit hole and seeing how inflation has really ruined our food system and essentially prevented people from revolting, because you're substituting high quality, nutritious food like meat and eggs and dairy with ultra processed food. And we don't realize, how pervasive that narrative has become, and different industry and government kind of working in cahoots together to make that happen. So I love being a connector. I love seeing, okay, here's what you're passionate about, or here's what your business model is. Here's how you're trying to grow. Well, here's how Bitcoin plugs into that. Because being so deep in the Bitcoin space, going and speaking at different Bitcoin conferences, very familiar and up to date with what are the newest tools or best tools to get people onboarded. And that's where, being in Pleb Lab, Bitcoin Commons, going up to Bitcoin Park a couple times, it's amazing to then have those relationships and say, oh, you're an entrepreneur and you're building this, or you want to integrate payments. Well, talk to Parker or John at Zapparite, or, let's talk to Roy at Breez, and let's get integrated in these tools, because as amazing and incredible as all the Bitcoin and Lightning tools that are coming and being built by people like yourself and what you're organizing here at Pleb Lab, we need to bring it then to the rest of the world and make that happen, ASAP. I see it like any business that's getting onto Bitcoin sooner rather than later is going to benefit, because everyone is eventually going to be a Bitcoin business, just like everyone now needs to be an internet company. So by tapping into that and trying to meet people where they are as well, and understanding, what those conversations are. I'm not going around, and definitely for a while, just trying to orange pill anybody I met, but now it's a little more selective. But if people are genuinely asking questions, want to learn about it, I love having those conversations. So that's why I wanted to even form a business around it and say, hey, if you really want to dive deep, let's spend time together, and we'll get you set up with the best solution that's right for your business, or create something new. Yeah.
So let's talk about that, because I think you hit on a lot of things there about, especially entrepreneurship and all these big cities. And I mean, I'm seeing it too, man. I think there's just I think we're going to see you remember last cycle where we saw this surge of Bitcoin meetups, just all the conversations that I've been having just here recently in the past couple months, even as far back as like 12 months. I think we're going to see the same thing happen with Bitcoin hubs. I think we're going to see a surge this next cycle, and we're going to see every major city pop up a Bitcoin hub. And I think because at this point, the amount of inbound that I get about that is like once a week now.
Wow.
Before it was like once a month. Now it's like once a week. And I think we're going to see that more and more and more. I ordered a map.
Nice.
So I can like pinpoint all the people that I've talked to, just so I can see like what it looks like visually. Because I think that's more striking. When you're doing Satoshi Health, how do you see that? Well, first let's talk about what it is, and then also like, how do you plan on taking that, like everywhere, I guess?
Yeah. So I'm really focused on getting providers or health tech startups, or really any business, integrated with Bitcoin. And that really starts with Bitcoin and Lightning Network education. Of course, there's amazing tools and resources out there. And for me personally, in my own Bitcoin journey, reading dozens of books, listening to the podcast, meeting people, going to conferences is amazing. But of course, you have very busy professionals that might not have the time, or have also been bombarded with a lot of the noise that we see in the rest of the, quote, crypto industry.
Right.
And maybe haven't come around to Bitcoin yet. So really spending time thinking about what is money. Here's how the fiat system works. Here's how Bitcoin works in Lightning, being very objective, and then going into the process of saying, here's all the options of solutions. You can go from, all the way from custodial to self-custodial. Each way along is going to be potentially additional work, depending if you're in person, e-commerce. How do you feel about KYC, non-KYC, fiat convertibility, all the different variables that a business has to think about, having those conversations, and then saying, hey, here's where I think the best tool is going to be for you, get that implemented, and then help spread the word through marketing and ultimate. And you see some companies, even like KC Cattle out in Kansas City now, where it's a couple tweets went super viral because it's very earnest. And they're clearly explaining, hey, here's why we're accepting Bitcoin. I think a lot more businesses that do that are realizing it strengthens their company, and especially helps just ultimately save you from that debasement that we all know is coming and is happening every day with $35 trillion in debt, and just a massive amount of spending, more than the country's earning. So, I think especially here in the US, and being able to speak the language with healthcare providers and knowing what those business model looks like, that's kind of where I'm starting, or at least, who I'd love to reach. But there's certainly really innovative businesses, and of course, Bitcoin being global, that I'd love to help as well. And my wife and I have been pretty nomadic, and I've been to 40 plus countries, and I love going around the world and speaking different languages and connecting, and just seeing that bridge that Bitcoin can be anywhere in the world, tapping into this open market, open network that 8 billion people can participate in, is super exciting for me. And, that's why I'm starting in this $4.5 trillion healthcare industry a year. I mean, there's just an insane amount, between a quarter of that spend being administrative, half of that's waste. There's just so much that Bitcoin can help fix. Is it just y'all right now? Is it just you and Satoshi Health and then crowdhealth that's literally doing this right now in the Bitcoin ecosystem? Is there anybody else? I mean, I know there's podcasts and other people like that are doing it, but like actually boots on the ground, getting it done. Yeah, there's a couple other companies I've seen, that are starting to tap into Bitcoin or in healthcare, because the industry is so large. There are different, segments to tap into. One is James Wong out at Nihauti. He's approaching it more from the pharmacy side. So interesting. Like actually looking at almost like an Oshi model for pharmaceuticals, and
for
drugs.
Like a rewards model?
Yeah, like drug rebate. Wow. The whole drug rebate space is a racket as well that you're probably unaware of.
No,
so there's this whole like pharmacy benefit manager space that the big insurance companies own the pharmacy benefits managers. They're setting the price again, basically just negotiating with themselves. And if you have insurance, you're going to end up spending way more on a drug than if you're uninsured. And on one of the, the Medalist RX or of the world, or Cost Plus, like what Mark Cuban's doing. So that space, and being able to support people that are uninsured but still need access to pharmaceuticals. He's building that. Obviously, crowdhealth from the being delightfully uninsured side of things, and being able to have this crowdfunding model for healthcare. But I think, not as it isn't that prevalent. I think people are becoming more and more open to that. I'm actually heading to like a health tech meetup after this, and going to be talking about what I'm doing as well. And trying to bring Bitcoin more to the health tech ecosystem, where people are trying to bring new business models in, certain disease lines, direct to consumer. But the challenge with healthcare is the payer has generally been the insurance company, and they have different interests than you as an individual. So it's difficult to scale and sell a new product or service in healthcare, because you almost always need the insurer's blessing. So that's why a lot of new businesses are going direct to consumer, and that's where Bitcoin comes in. And I think it can be relevant to any business model. And that's where I want to meet more and more of those health entrepreneurs too. And in my background, starting to connect with them and also being connected to a digital health product agency out of Uruguay. So I'm working with a company called Light It. Really as an advisor, but trying to help steer other opportunities to them to help connect entrepreneurs that need help building.
Right.
And even there could be some cool opportunities, I think, down the road to build really Bitcoin native healthcare software.
Yeah.
That definitely no one's doing yet.
Dude,
I've got some ideas for, but it's still a little too early. But I think we need the critical mass of more providers then that would be willing to, switch over from their traditional electronic health records to something that's way more Bitcoin native, maybe Nostr native. You have your identity. These are just massive fields. There's one health record system kind of on the back end that owns 150 million people's records in the US.
Really?
Caspian. Yeah. It's like all the way kind of in the back door of anything you're using on the front end. But it's just a huge honeypot for everybody's information. And you see this huge movement in Bitcoin, of course, for privacy, sovereignty, owning your own data, owning your own health. And that's where I see, trying to, again, bridge the gap.
Dude, it was, it's funny you brought up the entrepreneur stuff. There was a guy who came in the lab, I want to say it was 22, like late 22. He was trying to do, this is right around, I don't know when CrowdHealth launched, but he came to Plug Lab. He wanted to be a part of what we were doing here. But when we were talking to him, it was clearly obvious that he was like a, Web3 or whatever. And he didn't understand like why Bitcoin, right? But he was well connected to all the health stuff, and he was trying to insert a token where it didn't need to be inserted. I remember we spent like almost like 2 weeks trying to get him on the right. And at that point I realized I was like, we're not the person to do it.
Yep.
I don't know whatever happened to him. I haven't followed up with him, but I still think of that time where I think there are people who are entrepreneurs trying to do something in the healthcare market, industry, whatever ecosystem. They just trying to shove Web3, incentives in there when it probably doesn't need to be there.
Yeah, no, 100%. And I still run into that a bit where I've met some entrepreneurs that have some really interesting ideas and they're just still really set on either building in another, crypto ecosystem or making their own, shitcoin. And it's like, look, all of this stuff can be done, on Bitcoin, utilizing whether it's Lightning Network, Fedi, other tools that are coming out that can really change the game and help you plug into this network. You're not going to hit scale or reach with any other token or thing out there as much as, and you definitely saw that in previous waves, especially even like, in the 2017 run. That's still when I was deep in like the healthcare side and wasn't really even paying attention at all to Bitcoin and what was happening then. But of course you saw the blockchain and healthcare stuff that, hasn't taken off. I think some of the ideas were earnest and really thinking about ways to help, but I think we've seen practically that that's not how it's going to happen. And it's going to need to be, really driven entrepreneurs that can kind of see where the challenges are, but then also understand, the best way to plug in Bitcoin in the Lightning Network, because there's a lot of ways to do it. And depending on, how quick you want to get to market, the type of consumers you want to reach, where you want to reach them, that's going to change the equation in terms of how you integrate Bitcoin into your healthcare business.
So let's talk about that a little second. Because I want to know, like, what are some of the initial, get some Topo Chico. When we get to, what are some of the initial, let's say a guy wants to move into the allergy clinic market here in town, which I know because I used to do Cisco stuff here in town specifically. There's a ton of allergy clinics because of
the cedar and the pine, everything in the winter. It can get intense.
So let's say somebody had an idea for that. What are some of the initial problems that this particular entrepreneur would have on the healthcare side and then on the Bitcoin side?
Yeah, I think on the healthcare side, it's first understanding their payer mix. So the payer mix is who's actually paying for those services. So nationally, if you look at the breakdown of health insurance, it's about half commercial, meaning you're on an employer-sponsored plan. A third is the government, so Medicare for 65 plus or Medicaid for low income. And then you've got another about 8% or so on the exchanges, which came out with Obamacare. designed for entrepreneurs, but still very expensive plans. And then you have another 9% that are uninsured, and then a few percent more on government plans, military plans, TRICARE, and so on. So depending on that payer mix will also determine kind of how much flexibility they have. Because if they're really dependent on insurance, I'll say today it's probably going to be harder to integrate Bitcoin right now because the consumer isn't paying for that service. But as you go further and further down the spectrum to cash payment or operating outside the insurance paradigm for any health or wellness service, you consider chiropractors, acupuncturists, massage therapists, yogis, even. You think, I'm a yogi myself. I helped get a local yogi on board, Ali B Yoga. Actually, she also leads retreats to El Salvador, which is awesome.
Oh, that sounds like amazing.
You're going to El Salvador twice a year. You got to accept Bitcoin. So she's able to accept Bitcoin now too. So I think any provider that's more cash-based, that has that direct consumer relationship, is going to be able to implement Bitcoin quicker. So that, in terms of like the healthcare hurdle, is whatever their business model, who's paying for the service is going to determine. Also, is this something online? Telemedicine type service, probably pretty easy to plug in. Anything with a subscription model, so it's similar to crowdhealth.
So it's anything outside of the kind of, I don't know, like what would you call that?
Just the insurance system, and it's the bigger and bigger health systems. Here in town, we've got, St. David's and then Dell, Ascension. So in a lot of cities around the world, around the US particularly, you have monopolies, duopolies, or just a few big players that keep gobbling up the bigger specialists. You mentioned allergy, for example. If you're going to a primary care doctor that's a part of the St. David system, then they're probably going to refer you to another, allergist that's in their system, and you're just slapping your insurance card down and you're not, really engaging in the payment aspect of it. Of course, you can go and utilize their service as cash-based,
right,
but they're probably going to be less willing to negotiate, although generally they are, very much, and that's what crowdhealth helps on the negotiation side, in getting a better cash price for that service. But the providers that want to take the lead and recognize that they're either practicing medicine or healthcare or health in a different way than is maybe the top down, CDC guidelines on whatever it is. They have a more holistic approach to health. They're probably not going to be dealing with health insurance, because that's what's also led to the massive 3,000% increase in administrators compared to providers since we came off the gold standard in 1971, because you need all these people just to deal with all the claims processing, because each insurance plan wants all the data in a certain way to pay for the service. So, that's where I want to help empower individual, more entrepreneurial providers, such as Veronica Max here at UltraPersonal Healthcare. Was awesome to work with, because she has her own, family medicine, direct primary care business, monthly membership. Now my wife and daughter are, members there, and it's amazing.
So what does she provide, and how did that happen, John?
Yeah, just connected with her and thought, hey, she'd be a great fit for this, because it's a values thing. People that are already practicing medicine in a certain way, that they really respect people's autonomy and sovereignty over their own body. They want to work with patients too that will put in that proof of work and put in the whatever guidelines or recommendations they make, really take action to heal themselves, or, get less and less reliant on pharmaceuticals and become more and more, thinking about how they're eating. What are they, are they eating whole foods? You getting sunlight, you moving your body, doing all these things during the day. And then even considering light and EMFs and all the other, toxins that are in our environment that have led to a lot of the health issues that we see in the population. So she was already, that was very much her message. So I thought, plugging in Bitcoin here would be great. And got her set up with Zaporite. And I see Zaporite being an amazing solution for a lot of providers, especially those that are just invoicing, or you want a simple payment link. So I partnered with those guys to, because we see a lot of overlap. There were already a lot of dentists coming to them and other providers, because dental too, even if insurance pays for maybe half of the service, there's a lot of out-of-pocket costs. So any business that has more, service line that has more out-of-pocket costs is also going to be a good place to plug in Bitcoin. because you have more cash payments.
So here in town, a Bitcoiner who's listening to this right now here in town, they could go to Veronica, and what kind of services does she provide?
So it's direct primary care is really, think about a primary care physician. For a long time, you had a relationship with a provider that could coach you and help you. You're taking lab tests once or twice a year and looking at your body, understanding your unique health scenario, your own life scenario, and being really like that consultant too, to say, here are ways that you can improve your health. What do you want to work on? So people can get a lot of value out of, figuring out what their health goals are, and then having someone you can partner with like Veronica to coach you through that. And you get unlimited visits, access to, texting. And if you have questions, at any hour,
that's
really,
amazing,
you're getting
dude.
like that personal service and not just going to like a call center.
How much are we talking here?
Yeah. And for an individual, it's like $125 a month.
Oh, that's not bad.
Yeah.
Really?
And
that's
she's
less than
accepting
a
Bitcoin.
gym membership almost.
Mm-hmm.
Wow, dude.
Yeah. So it's really like the tools are out there now. If you're picking and choosing where to spend your money on healthcare, you're going to get a crazy amount more value than if you're just blindly spending $700 a month on your premiums and still having to pay a copay.
You could probably, so if we go to Satoshi Health right now, do you have all these people listed?
Yeah. I've got a few of the businesses I've worked with listed, and it's still relatively new. I wanted to kind of test this concept out, and had a baby a few months ago, so been a little busy on daddy duty, but it's been fun to
congrats on that. Man.
Yeah, I appreciate it.
Yeah.
Start having these conversations, because I think the market is getting ready for it, especially with this next bull run.
Yeah, I didn't realize all this was going on.
Yeah.
Wow, man.
Yeah. So it's been fun just thinking about, even in my own Bitcoin journey. Originally, I was doing a lot of writing in comparing Bitcoin to yoga, because I saw a lot of comparisons there.
Yeah.
And obviously there's a lot of health and understanding your body related on the yoga side of things. But I think professionally, and being able to combine my two passions of Bitcoin and healthcare, helping bridge the gap, find the best solution, and being that, objective partner to say, here are all the solutions that are out there. And it's probably stepwise, because maybe you integrate, Strike is a great solution for plug it into your Shopify store, or being the back end on Zapright for accepting Lightning payments, or
even fiat payments.
Yeah, or fiat payments. And I think people don't understand too the power that Strike provides individuals to actually spend fiat and utilize Bitcoin, the network, to lower everybody's transaction fee and get that value to the provider.
Dude, that's amazing.
So that, the consumer now has so much choice in how they pay. The provider also has a lot of choice in how they run their business, how strategic they are around, of course, you want to get your expenses down. The more cash flow you can run into your treasury and save in Bitcoin, you're going to see the benefit long term. So now any Bitcoiner that wants to support independent businesses, I think having more marketplaces, having more, like Oshi, for example.
Yeah.
Or even now what we're going to be working on here in Austin as ambassadors, but this Atlantis project.
Oh yeah. So yeah, let's talk about that too.
Yeah.
Shout out
Svetsky.
Yeah. Dearly missed in Austin.
Yeah.
You don't see him as much anymore.
Mm-hmm.
So that's another initiative you kind of taken on. What is Satlantis?
Yeah. So Satlantis is really a digital home for physical communities. So it's going to be a mix of sort of like a nomad list where you can go and rate the city, or if you're traveling somewhere and you want to understand, like, what am I going to go do? Where are the best restaurants? Where should I stay? What are the neighborhoods like?
Who take Bitcoin?
Yes, exactly.
Where are the hubs?
Where are the hubs? Who accepts Bitcoin? So they're starting with 50 cities around the world. There's only even, I think, 5 in the US. Austin, of course, is one of them.
The top one.
Yeah. So definitely the top city. Come visit Austin, but support your Bitcoin city. So, really to get past that cold start problem of, how do you start a network? Starting with Bitcoiners, of course, makes a lot of sense. So you have a lot of really high level ambassadors around the world that are already taking this community leadership role in their town or in their city, and will now have, I think, a much better platform to interact.
Because there's not one out there, right? Like,
no, I mean, you're still using Meetup, right? Like Meetup sucks.
It's not by choice.
Exactly.
It's just that there's nothing else, John. This is what I was telling you guys on the call. It was like, there's nothing else. Like, what else are we supposed to use? I mean, there's some Nostr ones, but they don't hit every person, right? And Meetup still hits the normie thing.
Right. Right.
You
So
know?
you might find people, obviously for our having celebration, it's on Meetup right now.
See?
But I think in the future,
Yeah.
when in Satlantis is being worked on,
Maybe
and
there's an
once it rolls
API or
out-
something. Yeah.
Yeah, well, there'll be an API with Meetup, but mostly it's, you have your identity with Nostr. So it's Nostr and Lightning integrated, right? So, and I think this will also really capture the attention of content creators. I was connecting with one recently in Austin that does Explore ATX and is like huge following, amazing videos on what to do in Austin, what's happening.
Yeah.
And he has the challenge of, how do I monetize this? Like it's so valuable, and likes on Instagram is one thing. Of course, you can
Zaps.
have partnerships and affiliates and whatnot, but that takes additional work. Exactly, Zaps. You put out the content, people find it valuable. So I think those types of trip guides and tour leaders, or people that really are amazing at highlighting what's the best to do in a city, hopefully will find a lot of value moving over to a platform like Satlantis, because it can be more of a hub where it's just value for value, win-win. And whenever I tell people about Wave Lake, they're like, their mind is blown.
Yeah.
Musicians can get their value directly.
Yeah.
You're getting sats directly, through Fountain, and there's just people don't know that these tools exist.
I know, that's so
it's
weird,
just
right?
So so
It's so weird.
we need, that's where I see a role too, of just helping to connect the dots and reach out to, my friends or people in these different industries and say, at least, hey, look, like if you want to start, getting Bitcoin and, you hate Spotify, just put your songs on here. I actually used to manage a rapper a few years ago in Chicago.
Really?
Yeah. Back in,
Who was it?
shout out to J. Raji.
Oh, wow.
He's now down in Atlanta, but, and it was hard. It was like, okay, you're going to do some shows. We got him on Spotify, but it's incredibly hard to monetize as a musician, is one example. But I think,
you need the network.
Think about, or concerts. Yeah. You need the network.
Yeah.
So there, hopefully, I'm pretty optimistic that the tooling will be there and the experience will be great. And especially as a nomad myself, traveling a lot, we'll definitely utilize it when traveling, moving forward, and being able to connect even easier. Of course, you can go on Twitter and try to find, if you're tapped in, but it's like,
they bury a lot of Bitcoin stuff on Twitter.
Yeah, that too.
Quite frankly,
So this will be
Elon's very short Bitcoin.
So that's this Atlantis project, which I think will be another way where, in all of my projects, they could get on, right now we BTC map, but it's, not perfect, and it's a tool that's out there, but there can definitely be better solutions. I think everyone realizes, in just a better curation process, or an easier way for people to, if their business too, like shout from the rooftops, hey, I'm accepting Bitcoin. Like, here are all the reasons why, I'm not just LARPing. This is a reason, here's why I believe in Bitcoin, or how it matches up with whatever good or service they're selling. Because you see then this tie-in for those businesses that are clean products, right? They're not having seed oils in them. They're, whether it's the Talos of the world, the meat bars, it's like, Outpa, all these stories are so powerful for the entrepreneurs. And you want to, personally, I've tried so many of the products and I love them because I know where it's coming from. I know it's in them, versus going to a big box store and buying those products. So the people that are already into Bitcoin tend to have a product that is healthy, clean, and they want to find more people that will value that. And that's where I think you see that overlap of health and Bitcoin so deeply.
Do you think there's a kind of a parallel economy being created right now everywhere in the world? Do you think, I know, especially in Austin, you can already see it. Like you and along with other people have kind of taken the torch and like literally are getting these things like set up, and like what you were just talking about with Veronica and Satoshi Health, like all that kind of stuff. Do you think we are doing that at some point, and just like a tipping point that comes over?
Yeah, I think it's still early days, but being able to create those parallel economies on Bitcoin and getting more businesses that are providing things that we're going to need as humans, regardless of how we're paying for them,
right,
continue to exist. That's really important. And the monetary premium that's baked into homes or baked into other goods that are really consumption goods, but have become this vehicle for savings. You just have really distorted pricing signals in general. So the more businesses that start moving onto a Bitcoin standard, I think we're still early for using Bitcoin as a unit of account. I think it's great to think about it in terms of Bitcoin and Sats flow. But of course, pricing things right now, you still want to meet people where they are. And, you might have the fiat rail alongside the Bitcoin rail. But you need to incentivize people to pay in Bitcoin. So give them that shared savings of like Mod Bikes is going to give 2% back if you pay in Bitcoin, and then, another 5% in sats back for their bikes. And this is a bit of a bigger purchase too. It's a couple $1,000 e-bike, but it's an amazing, innovative product that I think a lot of people will like. But then you see, okay, what are the incentives? Why are more consumers going to start wanting to think about now, okay, how do I get some Bitcoin to pay for this? Well, you don't necessarily even need Bitcoin, right? Maybe you just need a Strike account and a bank account to take advantage of some of this stuff. But that comes with education. That comes with people understanding, at least at a base level, how it works. And we're not going to understand that, how our iPhones work or airplanes. There's so many things we trust, of course, in society. And that's where this 20-year Lindy effect, I think, comes in. And as something is really embedded in the society for, that 20 years, like the internet has been now, we can't envision a world without it. And of course, we're still now at 15 years for Bitcoin, really excited that, this is the first halving I'm paying attention to. And it's like amazing, even just in a few years to really come 180 and now realize, what I'm passionate about and what I want to work on and how I can bring value to the world.
Dude, you are, man.
So
it's
I appreciate
amazing.
it. I'm trying.
I'm waiting for you to find the house builder, the guy or the family or the team or whoever it is that's gonna be like, hey, I build houses and I want to take Bitcoin for it. Like, waiting for that guy, John. Is he out there in Austin?
There was just a guy in my DMs who says he's an architect and he wants to chat. So I'm happy to chat with you too. And because you hear I listened to Leon Winkham recently and hearing his stories and just having an understanding of the real estate market. There's opportunities in every industry, and the people that have the history, and that's what's so cool about Bitcoin is you've really had people come from such different backgrounds because Bitcoin didn't exist 15 years ago, but also wasn't, you couldn't build the things that are being built today on it. So I think being able to build circular economies, but really this parallel economy that you mentioned, and then having that discoverability where each month you have one more service or one more product in your life where you are away from someone that's only accepting fiat, and you start going to those providers that are accepting Bitcoin. But where are the providers accepting Bitcoin? That's, Parker's pay me in Bitcoin theory. And I think that is how Bitcoin will continue to proliferate. It's going to be the entrepreneur, the merchant, the business owner. That's always in, the history of humanity as well. How did all this trade proliferate? It was merchants, having, whether it's information arbitrage or being able to connect to distant lands and get them goods that were relatively scarce in their area, and being able to create value for people in their lives. I see the same for everyone around the world, merchants that are starting to accept Bitcoin, and skipping the tools that can lead towards way more centralization, oversight, lack of privacy, that is coming in the CBDC landscape. So I think people are going to have to choose, and the choices are already coming. Obviously what Marty's been highlighting and TFTC, everything there, syndicating even a wider, reach of information can help people wake up, but it's ultimately going to be individuals deciding where are you going to spend your hard-earned value to live your life the way and live, as my wife says, actually along your highest possible timeline. And moving forward.
Yeah, it's one of the cool things about really understanding Bitcoin is the values that it also comes with too as well over time, right? It just teaches you certain things, and you're a better person for it, I think.
It's that low time preference, and I'll say for sure, becoming a father changes everything, changes the perspective, and you start thinking about all these things you had no idea about, just about the environment, as your wife nourished, breastfeeding, how are you going to deliver all the questions afterwards, and everything you're introducing to their lives. And they're going to be, she's going to be Bitcoin native, right? And they won't know a world without Bitcoin, this next generation. So even like those children's books out there, and you see a huge entrepreneurial spirit in kids, in that 8 to 12-year-old range, especially as they start to get a lot more autonomy and want to be, I can earn some sats, like doing some chores or something else. So I think thinking further towards the future, I don't think that that Bitcoin standard is as far off, and not rooting for it to happen tomorrow. I think there would be some chaos, and I don't want that. And I think the more people that are comfortable with Bitcoin, using the tools, that's where the different clubs. Whenever I tell people about Austin, it's like, we have Austin Bitcoin Design Club. Like, it's amazing. Talk about, user experience and critiquing wallets and how people use them. And can your grandma really use this app or not? I love those conversations, and
those are some good conversations.
I'll be going home, soon, and seeing, my grandparents are, thank God they're doing well. They're 89 and 88. And it's like, I'm telling them about Bitcoin, and, but would they be able to use wallet? Like, I don't know, like, we'll see. But even for, the boomer generation, more so, I think you see more of them. I think
I think they'll get it. I think it's kind of like, Gary's a perfect example. He always talks about it all the time, right? Like, if Gary Leland can figure this out, well, Gary's really, really smart. So there's that. But I think they can, just like email and the internet initially. It's the same thing like that.
Yeah. But at the same time, I think it's harder for any individual to unlearn something that you've known to be true for a very long time.
Yeah, that is true.
The financial system has worked a certain way for the last 40, 50 years.
Yeah, that's true.
And the fact that that's crumbling down, you think your stocks are safe in your Schwab account. Well, how's the government going to pay for the $35 trillion in debt? Look at the other countries like Cyprus a decade ago, or others, Argentina all the time. We were there a little over a year ago, and they've had 250% inflation since I was there. Like, it's crazy, right? And obviously you have Malay coming in, we'll see what changes, but it's sad when you see like how much fiat currency has destroyed different people.
When we were in the UK, like, you can see it being across the pond, how inflation and like the active recession that's happening right now in the United States, you can see it. And I don't remember ever thinking that. It almost feels like they're like kind of bullying us like frogs right now. But when you're away, you can see it, because the pound is stronger than the dollar over there, which was shocking to me.
Yeah, and it's generally been that way, even though, you look at the pound, devalued 99% since.
But then you talk to people in town too, and they're just like, "Oh, you're from America." And it's just like, there's this conversation, right, of like the spending and the access. And one of the things I heard from a pub, we were in a proper pub, and one guy said, he goes, "Y'all's houses are ridiculous. Like, why are they so big? And then y'all's consumption level is massive." Mm-hmm. And this was something they were talking, just about Americans. Yeah. They weren't singling us out. It was just a conversation we had. And I think the world is paying attention to that. And I think the spending is, it's always been a problem, but now it's getting talked about in pubs. Yeah.
And you definitely, when you get out of America, you get out of the bubble, definitely see that perception shift of America or Americans. It's not, the 90s with the American culture just shoved down everybody's throat, and
they love Texas though.
Team. Yeah, and I love Texas too. I didn't. I grew up in Illinois, so we didn't take the Texas history test, but through reading and Empire of the Summer Moon and some books about the Alamo, it's like, man, there's such an amazing deep history of sovereignty in Texas. So I think it's not surprising that you also see these hubs, especially Austin. But obviously with Houston and the energy, and then Dallas being, having strong Bitcoin communities, as well as, up in Round Rock and down in San Antonio where I've been to speak. And it's like, okay, we see, I was even talking to a provider that was down closer to the border with Mexico. Oh, wow. And it's like, I don't know, like, are there some more Bitcoiners out there? Like, I think it definitely makes sense for you to, integrate Bitcoin in your practice. But that's where like these hubs and knowing, okay, who are the cities in place, because the merchants too, it's a little bit of chicken of an egg. Like, okay, if I do this, who's going to actually pay me in Bitcoin? And I think that is less important today. And what's more important is you have the ability to accept Bitcoin if you need it. And you may feel like today you don't need it, and it's like a nice thing to have. But if your bank account gets canceled or you're getting censored for whatever reason, you have this other payment rail that you could now switch over to tomorrow and not have an interruption in your business. And that's one of the biggest challenges I see in the legacy healthcare system, where there's so many risks to a business running and just operating. For example, Change Healthcare, which is a part of United Healthcare, which, by the way, had $8 billion in profits in Q1, despite having a hack of their electronic medical record and claims processing system so that for weeks, more than a month, it's been ongoing now, even 2 months, providers had not been getting paid billions of dollars a day.
Really? What was he doing with the money?
So it was hacked. They paid out like an over $20 million bounty, but despite paying the bounty, they still weren't paying providers. And now actually, this is how perverse it is. United. So now these providers can't pay their rent. They can't pay their employees. Their business is going under. United swoops in with all the cash they're sitting on and they buy the independent practice.
Oh Lord.
And that's what's happening.
Gosh.
It's horrible. And there's no repercussions. They're not offering any compensation to the providers. So that's why more providers are waking up to the fact that if you're just accepting insurance, like that's a risk
You're
to
gonna
your
get
business. Rugged. And if you know that you want to do this, you got into medicine for a reason to be a provider. And even there's a whole nother, stories on all the gatekeeping that goes on in medical licensure in the first place. We have massive shortages of providers, especially in rural towns and other places. So it's really hard to even get into it in the first place. That much harder to keep running a successful business with the way that health economics is going now and the incentives. And the government pays less and less every year for the same service.
Right.
So yeah, that's just one story of something that happened recently that even has not been making headlines. Most people probably wouldn't even realize while this, one entity is processing even more than $1 trillion in claims a year.
Well, what other healthcare? You said there's meetups with healthcare in town. Mm-hmm. Are they all at Capital Factory, or where are they all taking place at?
There's Health Tech ATX that it's different bars and stuff.
Okay.
Sometimes we'll meet at Easy Tiger, for example. It's just like, it's pretty informal.
So is there, like hearing you talk about all this, it sounds like there's this big healthcare movement happening in town. It sounds like a lot of them are becoming aware of the rugging potential in their business or structure platform, whatever you want to call it. It almost seems to me, and call me crazy, but it almost seems to me that there needs to be a conference or some sort of summit of a sort to kind of get all these people together and figure this out locally, and then move towards an initiative. I'm a firm believer that if you create something and you just build it, they will come. It's kind of like
you did that here with taking Pleb Lab to the next level.
Do you ever see that? You ever see that stat where they talk about when they build more freeway or more, and all it does is it just increases
more cars on the road.
Yeah, it doesn't actually help like reduce traffic. It actually increases traffic. It's the same thing with people. Like if you get them in an initiative that they all can rally behind, you'll start seeing people actually make strides in the direction that the initiative is pointing towards. It's just, it sounds like, dude, it sounds like you're on the cusp of something like that with Satoshi Health. You might have something there, John. I think you do.
I appreciate it. Yeah. And I think having more, even just starting with educational opportunities,
right?
So wanting to offer more like master classes, Bitcoin 101. Like we're so deep in it here that someone walking into BitDevs is gonna be like, not understand a single thing of what's going on. And I love going to BitDevs because I'm not a software developer, but I'm running a node, and I know now from going enough of the talks and discussions, like what are we talking about, even if I couldn't go do it physically, but able to, participate in those conversations. But anyone else walking in, it takes time to get comfortable with all the aspects of Bitcoin. And then especially as you layer on, the Lightning Network, eCash, Fedimints, like my, just light bulbs are going off all the time, and thinking about these community-based care models. Like there's such a buzzword in healthcare called value-based care.
Yeah, what's that?
Where they essentially started trying to move away from fee-for-service, where traditionally hospitals or doctors are paid based on the number of services that they do, and which actually incentivizes them to do unnecessary and more services than they need. So there tried to be a movement to incentivize providers and having these whole accountable care organizations and partnerships and whatnot that came out of Obamacare to try to lower the cost of care overall.
Right.
But it's really a buzzword that hasn't seen a lot of movement. There's not really incentive or any cost savings involved with these types of programs. So when I hear, value-based care or truly aligning incentives, it's someone like Veronica or others that actually want to keep you healthy. You actually want to keep you
it's like preventative
out of the hospital. Yeah, more preventative rather than heads in beds and needing more people to get surgeries to pay your bills. You want to keep people out of the operating room, and that's where, Sean Baker is a big crossover. I got to meet him at Bitcoin Park a little while ago. But he's big in the carnivore space. He was an orthopedic surgeon, like absolute beast.
Really?
Like he could do, dozen surgeries a day or whatever it was.
Wow.
And then he started realizing like, why am I operating on all these people? There's certain things they could do if they shift, diet or lifestyle that I can keep them out of the OR. But then the hospital didn't like that because they saw their revenues going down. So that's where the incentives of like the system are a little bit perverse. Of course it's not one individual, but this is 20% of the economy. There's a lot of jobs, people working on this stuff where, we need, there's no single policy or, any buzzword like value-based care that's going to fix it. It's going to be people taking responsibility for their health,
ground up,
figuring out, what they need, who they need to talk to, what are the types of modalities. A lot of Eastern medicine or more holistic approaches, functional medicine has been cast aside in the US, or even going to birthing centers, home birth, understanding what is involved in these processes rather than fear mongering around it, empowering people to know what the experience, will be like, getting a provider that meets your needs. Bitcoin
do we have that in
those
town?
values.
I know we had I don't want to dox anybody. I know we had a string of newborns in the community. Is there somebody taking Bitcoin now for home birth?
Not yet. I'm working on it.
Okay.
I have a good friend who's a midwife, and I think they'll get on there eventually. But and that's where it's just there's so many opportunities again to, I think to integrate Bitcoin into healthcare, and the legacy system is very complicated for a reason. And there's no perfect system. I've studied this around the world. You think socialized medicine or, government, taxpayer, is going to be better? Well, no, because then that really is coming out of your pocket and you have no choice. Right. If you're up in Canada or in Australia or even in the UK with the NHS, people tend to buy secondary private health insurance because if you, injure your knee, now all of a sudden you need a knee replacement. Well, have fun waiting 6 to 12 to 18 months on that list to get in.
Wow.
So people that have resources, obviously they pay and they go around it anyway, but they're still paying for their government healthcare that they're not using. So, my understanding has definitely shifted, and my opinions now, even having gone, deep in the school side and seeing, what is being taught at these higher level institutions versus now my own experience and journey. I want to help bring that to light and empower those local providers, those chiropractors,
You're
those
doing it, man.
That's
amazing.
Therapists or whoever that, really can benefit from Bitcoin. And I feel strongly doing that because I know how strong, you are in Pleb Lab ecosystem, Bitcoin Commons, all the different, tools that are getting and software that's really amazing that's getting built. And it's so early that it can be so flexible. And I think the more people that leave more of the legacy industry that are Bitcoiners that want to get into this, but of course have the reality of paying the bills. And, when do you make the leap? When you go for it? Everyone has to make a different decision for themselves and what's best. But
I was talking to somebody today. They're an entrepreneur. And they said, Car, I'm leaving my job. I'm like, really? You're going to build on Bitcoin full time? He's like, yeah, we're going to build on Bitcoin full time.
Hell yeah.
I was like, wow, dude, congrats. But I think you need the infrastructure for this.
Yeah.
Call me crazy, but I think you need infrastructure to go and do this stuff. And what you're building right now is infrastructure. Obviously, it requires a lot of hand holding and a lot of your time, but you're willing to sacrifice that. And at a certain point, you're gonna bring more people there, and then you have more people helping out with that. Really does take a village for these things. And bullish on what you're doing, man. Incredible. It's
man.
incredible, dude. I've seen you from just the sidelines and doing all this stuff. And I'm just like, when does Jon sleep?
Baby's still waking up a couple times a night, but we're getting our sleep, staying active, running, going, and trying to be a part of the community in any way possible. And I love to hear that you're getting such an inbound interest from people around the world. And I hope you'll continue to share the message. And curious to hear, like, is it just builders? More software? Are you seeing people in different industries? What's the interest?
I think one of the biggest things, because we've been doing this is year 4 for me, doing Pleb Lab, year 4. Wow. 4 years. That's amazing. A long time.
It's amazing.
And it's year 2 for me being CEO. So there's a lot of pain that happened the first 2 years. right? And there's a lot of pain the first 6 months in this new role. And I think being able to talk to people and spend just an hour of my time giving them some, be careful for this, watch out for this. Like, this is like, basically I had this conversation in Bedford, and I won't say who it is or where the location is, because I don't want to do that. But I'm sure they wouldn't appreciate that. But anyway, spent like an hour with them, telling them, I was like, hey, I'm going to save you 2 years right now.
Yeah, exactly.
He was asking me every question. He's like, but why did you, and then what was this? And then what was that? And like, I was just like, dude, no, because this is what's going to happen. And he's like, oh yeah. And it just, and if I could do that for people, then that's going to save them 2 years of pain.
Yeah.
Money that they're going to be lighting up on fire. And so if that can get them that much faster to the goal line, to me, that's just the easier way to get to, because like, Bitcoin's our equity, man. Like, that's really the thing that's going to change things for you personally. All this other stuff is great. Don't get me wrong. Living a dream. You're living the dream. We're all living the dream, right? But at the end of the day, we all hold Bitcoin, and we're incentivized to make sure that this actually gets to the goal line, and we get this across for hyper-Bitcoinization across the world, and humanity's saved. I mean,
exactly. I mean, we're all in the Bitcoin marketing team, and that's one of the beauties of Bitcoin is it's an open network, and every person that decides to join the network with their value and what they can contribute benefits everybody else in the network. And that is just the complete opposite of our current inflationary fiat theft environment, where everybody feels the zero-sum game, where they feel like they need to earn their money twice, and they need to beat the inflation rising, and even the numbers are rigged, and it's impossible to even know what the true numbers are, but people feel it, and you feel that environment. And it almost is always like people, these days walking a little bit on, tiptoes and sensing something's off, but not being able to pinpoint the why. Of why their industry is broken or why the incentives are off. And it just always comes back to the alchemy that is the fiat money printer. And if you can create value out of nothing, you're going to have distorted pricing signals across the market and a certain wealthy benefit at expense of the majority, really, and putting a lot of people in distress. And of course, if you're stressed, you can't think about this stuff. You can't, you're just trying to put food on the table. It's really, really challenging. And you see that, all over the world, even in Sri Lanka, a couple of years ago, they had some huge riots, and it's because food prices were rising like crazy, and they ended up getting their president out of there. But having spent time in Asia and in Latin America and Europe, all over, in Africa too, like, you see the challenges that locals have gone through. You listen to the stories, and most of them even understand Bitcoin right away, because they've seen their currency debased. Right. They know their government's corrupt. So ultimately, separating money and state is the goal of Bitcoin, or a big reason why I'm here. And there still will be a role of the state, but it's going to be a lot smaller, and they'll actually have to have consent of the citizens to spend on whatever they're spending on. And it just can't continue like this. And as you read history and the saculum, the 80-year life cycle of the individual or of a community, and you have this, the constellation of archetypes of generations, and alongside of these 20-year periods, and our demographic is very much the hero generation. I think, not to toot our own horn, but it's looking around and you look in the room. It's like the millennials who we grew up one way. It's shifting now to another way. We've got, hopefully a lot of great years ahead of us to really build the future we want to see, and rather than just trying to hold on to the legacy systems where we see the writing on the wall. And, just to give one health example, Medicare is going to run out of money in 5 years. Like, that's in the budget. Okay, you think that's going to be around when we're 65 plus?
No.
Good luck. Like, even for, our parents who are turning 65 now, it's like, okay, get the surgeries maybe you need done now, because the government every year is paying less and less for the service. And who's going to provide those services for less dollars? That's where the docs are just opting out, and they're leaving. They're going to do something else. And there will be a demand for health. Like, there's a lot of amazing things about conventional, modern medicine, of course. And, with surgeries and trauma and dealing with these things. But generally, from a chronic perspective, dealing with chronic issues is not where the current system does that well. And that's where finding aligned providers that can really partner with you in your health journey, whatever your goals might be. I believe those providers, they're out there and they're going to be accepting Bitcoin very soon. And I'd love to help them do that.
Nice. I just want to touch on real quick what you said, something about zero sum. And that got me thinking to some of the things that we talk about here at the lab is just like every business out there right now, whether they like it or not, are going to be a Bitcoin business. And it is a zero sum game, and the most Bitcoin wins, right? So if you're not trying to figure out how you're going to do that, you should probably start a Bitcoin company, because that's the second best thing you can do.
Yeah. But the beauty is, of course, we have 21 million Bitcoin that will ever exist. In that sense, we have ultimate scarcity, but the value of that Bitcoin in purchasing power terms will continue to increase in my mind. Yeah. So that's where, in terms of abundance of energy, of health, of shelter, of food, of whatever it is that we need to survive as a species, that will continue to become more abundant because of that scarcity in money.
Yeah.
Right. And that's what Jeff Booth talks about all the time. And we have scarcity in, when you have abundance in money, everything else becomes scarce. And then we have price inflation and so on. So it's a zero sum in terms of like the number of Bitcoin, but it's not in terms of the amount of value that we can provide to one another and the lives that we live. So that's where I think
I do think though that if you don't have a way of if you don't have a way of getting a hold of some Bitcoin, your second best thing to do is probably start a Bitcoin company. Because at that point, then you can start accepting Bitcoin. And
I tell people, that's what I tell my clients is, look, you can go and, buy it on an exchange right now, but you're still going to probably have a 1% fee or whatever it is. The most efficient way is to just accept Bitcoin directly onto your balance sheet. And eventually we're not going to be able to go to an exchange, because the number of Bitcoin, 2+ million Bitcoin on exchanges continues to dwindle since even the last cycle. And that number is going to continue to go down as the tools get better for self-custody, as people learn about, taking control of their own keys, getting their money off Coinbase, getting their Bitcoin off of whatever exchange it is. And obviously that's a whole nother, honeypot and conversation where the ETFs are holding their Bitcoin for the most part. But look, it's a really exciting, it gives me a lot of hope.
Yeah, totally. I'm getting bullish right now just talking about it.
It's the best. It's like, if I could talk about it all day, then that's what I want to do. And that's why I started this business and trying to help, have these conversations, because people need to sit down and think about it. And even Bitcoiners that are further along might say, like, I'm a little nervous about now combining, this personal passion of mine with whatever business I'm running, and still having that hesitancy of really putting yourself out there, really combining the two. But ultimately that's where we'll thrive the most, is when you are feeling your dharma, which, your passion, this is your purpose in life.
Exactly. That's what Bitcoin allows you to do.
Yeah.
I'm going to do rapid fire real quick before we end this, because I know you got to go.
Yeah.
So just real quick, rapid fire, a couple questions.
Sure.
Or 3 questions.
Okay.
What's your favorite place to visit in the world, or that you've been to, that you're just like, man, I need to get back there, Car?
Wow. That's
because I know you do a lot of running, and you show me pictures of you running in these different locations. So maybe that's
I love Tel Aviv. Spent a lot of time in
Israel.
I studied in Jerusalem, being on the Mediterranean, to run along the water there. It's a special place. I speak the language, and so for me, it's always a place I'll go back to. And it's been horrible and hard to see the attacks that have happened the last 6 months and the bombardment last weekend. But the people are strong. They'll survive and thrive. But for me, it's always a place I've come back to ever since I was 6 years old, and have a special connection.
What's a book that you're reading right now that you want to recommend to the audience out there?
Yeah, well, I just finished it, but I'm definitely going to shout out Fiat Food.
Yeah,
I just read that the last couple weeks. And it's an incredible deep dive that Matthew does in understanding this. If you want to learn more about, how inflation has messed up our food system and ultimately our health, it's great. And really love that book. I also love when I'm running, I like to listen to books and stuff too. But that's one that definitely will be recommending to a lot of people moving forward. Okay, and the last question: if there's one business type that you want to onboard this before the end of this next cycle, what would it be, or what type of business are you looking forward to onboarding? Yeah, I'll say it's the direct primary care business model. You have hundreds of these providers. There's a big network and community of these types of providers that I'm trying to break into a little bit more. And I think that they're perfect for Bitcoin because they're cash-based. They're offering these valuable services in a more personalized way. And by tapping into the Bitcoin network, as we all know, it can be a cheat code for growth.
Nice. Cool, dude. Where can everybody find you if they want to get in touch, if they're a company or a business that are looking to get onboarded? Where can they find you at?
So I've got on Twitter and Nostr, at the Bitcoin Yogi. Check me out there. SatoshiHealth.com is my website. Feel free to shoot me a note, John, at SatoshiHealth.com. I'd love to chat and have these conversations about Bitcoin and how you can integrate it in your business. You should be able to reach me over there.
And then they can see you at the having party on Sunday.
Yeah, I don't know if
we're gonna drop it tonight.
All right, hell yeah, that's amazing. Quick turnaround here. Yeah, so Sunday 11 to 3 at Sapien Center. We're gonna have some great some beef. Thanks to Johnny. Chef Johnny.
Johnny's a legend.
We're gonna have a Bitcoin market with
Bitcoin market.
Yeah, Regenaissance.
What?
So 100% cotton clothes that Ryan runs, Noble Origins, mod bikes.
Oh my God.
Some kids selling some lemonade and fun stuff. We'll have some Medici coffee, bone broth on tap. It's gonna be a fun event.
Who's speaking?
So Matthew Lisak has given kind of a keynote, and then I'll moderate a panel with Brett from Meat Mafia, Frank Cayley.
You got the Meat Mafia guys there?
Yeah, the Meat Mafia will be there. Wow. Frank Cayley, who is an RD, registered dietitian, has a really holistic approach to nutrition, and then Brian Sanders as well from Food Lives, founder of Sapien Center, Peak Performance Podcast. So we're trying to bridge the gap here, where I know a lot of the Bitcoiners have already signed up and will be there and want to celebrate the halving, but even bringing that
at the Sapien Center,
to the
right?
health, more to the health community and getting more of those interpersonal connections built. So
how many tickets are left?
We've still got a good amount of tickets. I think we're approaching that 100 level, but
so they need to buy them now.
Where
can they get it at? Is it
it's on Meetup, but through Zapprite. So go to the Austin Bitcoin Club, Twitter, and Austin BTC Club. And all the info's there. I've also been posting about it. So I would love to hang out with you on Sunday.
Yeah, I'll link it too.
Cool. I appreciate it,
man. Thanks for coming on the show, man.
Thanks for having me, Cara. This is it's been super fun, and looking forward to continuing to work with you and seeing how we can bring Bitcoin.
Dude, we need to do a health conference.
Beautiful city of Austin. Yeah, there's like this KetoCon thing coming up next month that I'll go to, but it's like, we need to have a specific
maybe
Bitcoin
do it at the Sapien
one.
Center. See?
Yeah, and we'll have more events there. Yeah, we had a Bitcoin and Beef event about a year and a half ago that Tristan Scott brought.
Oh, nice.
And their company, Daylight's awesome. That new, and that's going to be great for
We
your
should
health.
try to be doing these summits every month, dude.
Yeah. And
like
then,
everybody,
And then Bitcoin and wine. Shout out Ben Justman. We'll have some Peony Lane wine as well.
Another legend.
Got a case. So that'll be the only wine we can celebrate with for the halving. It's the best, the natural stuff. And that's the tie-in, there's no bullshit in it. It's, wild yeast.
He's a Bitcoiner.
Strong grapes, the soil up in the 6,000 feet Colorado range. So we'll bring that here to Austin. So looking forward to hanging out with some plebs over there.
Stop until the drop stops.